name is Alex, and today we are going to learn how to insert an NG tube. So there's quite a few reasons why a patient might end up needing an NG tube. First, we talk about nutrition. If a patient is not able to get sufficient oral intake, we may place an NG tube so that we can give them direct nutrition. Next, we may need to remove stomach contents. This includes ingested toxins. Other reasons could include a bowel obstruction, where we need to relieve some pressure in the stomach to relieve the bowel obstruction. Of note, children and babies may also need NG tubes for things like prematurity or developmental delays. We also may place an NG tube due to some dysphagia. If a patient is having difficulty swallowing, we may place an NG tube to help them get the proper oral medications and nutrition. So, now you know about why we place an NG tube. Let's get started. In order to perform this skill, you should have all necessary equipment ready. You should have a towel, a cup with water and a straw, lubricating jelly, the NG tube, tape for marking, a fastening device, gloves, a piston, and tissues for your patient. You should also have suction set up and ready in the room in the case that your patient were to start vomiting or bleeding excessively during insertion.
We are ready to begin our NG tube insertion. So the first thing we want to do is make sure we have all of our equipment ready, including suction at the bedside. Next, we want to make sure that we're doing all of our education for our patient. We want to let them know what the procedure is and why we're doing it. Next, let's begin by washing our hands and putting on gloves. For the next step, we're going to ask the patient to blow out each of their nostrils to see which one might have an easier passage for the NG tube. Mrs. Smith, can you please blow out each nostril? Good. Today we're going to be inserting the NG tube in the right nostril. Next, we want to measure our tube. So, to do this, we're going to take the tip of our tube and place it at the earlobe. Next, we're going to go to the tip of the nose with our tube. And finally, we're going to go down to what's called the xiphoid process. From here, we are going to add about 10 centimeters or 4 inches in an adult. Once we have our spot marked on our tube, in Mrs. Smith, it's going to be 35 on our tube. We're going to mark it with a piece of tape. Now that it's marked, we know where we need to insert tubes to make sure it's in the proper location. So, next we're going to educate our patient on when we want them to take sips of water during the insertion. We want them to take sips of water when the NG tube has passed the nasopharynx and is right above the oropharynx. By having them swallow sips of water, we are helping them to advance and swallow the tube. It makes things a little bit easier on the patient because this is an uncomfortable procedure. Next, we're going to prepare the patient by putting a towel over their chest. This makes sure to keep the patient clean should anything fall or drop during the procedure. Next, we are going to lubricate the tip of our NG tube. Once again, this just enhances comfort for the patient during insertion. We're now ready to insert our NG tube. You are going to gently insert at the nair. If you feel resistance, you're going to pull out and try again. If you're not feeling resistance, you can continue to insert the tube. Now, I'm at the point where I have reached just above the oropharynx. This is where I'm going to ask Mrs. Smith to take multiple sips of water and continue to swallow. At this point, I am going to continue to advance the tube until I reach the area on the tube in which I marked with tape. From here, when I have reached that point, I am going to use my fastener on the nose to keep my tube in place. If I feel that it is not secure, I can also add more tape. So we have our NG tube inserted. What do we do next? The answer is confirm placement. Our golden standard for confirming placement of an NG tube is with a chest x-ray. The provider will order this, and once completed, the radiologist can let us know how we did on placement. Sometimes we have to insert the NG tube a little bit further, sometimes we need to retract, but they'll let us know. As nurses, we also have a couple other tricks up our sleeve that we can do to confirm placement just for our own knowledge. But once again, the golden standard is that chest x-ray. Make sure you get it. So one of the things that we can do as nurses is using a piston, we can insert air into our NG tube while holding the bell of our stethoscope over the stomach. We should hear gurgling if we're in the correct place. Another thing that we can do is take out stomach contents. There's two things we can do with those stomach contents. One, test the pH, and two, use our assessment skills to determine if this is actually stomach contents. Once again, these are just tricks that nurses have up their sleeves. Our golden standard is going to be the chest x-ray. Mrs. Smith is going to need that chest x-ray to confirm placement before I can give meds, nutrition, or connect to suction. Thank you for taking the time to learn how to insert an NG tube with me today. I hope this video helped, and good luck on your evaluation.